2024. So if we can please share the slides. So why actually are we interested in transformative systems approaches? We can go through to the next slide, please. So as a group of national public health institutes, we've been grappling with this topic, transformative systems approaches, for 2 years. We've been trying to think about what it actually means for us in our national public health institutes, Planetary Health, One Health, and transforming our systems. And we've really been recognizing that there's an interlinkage, complex interlinkages and interconnectedness of global crises that ultimately affect public health, population health. And this is a question for us not only at global scale, but actually within our national public health institutes themselves. How can we make sure that this transformation in order to address these complex crises can be addressed within the work and our approaches in our national public health institutes, together with other actors and other sectors? And this poses a number of challenges to us as national public health institutes and dilemmas as well. How do we consider political priorities against the need for transforming some of our systems? How do we address some of the power asymmetries that come up when we look at this question of systems approaches? And there are no easy answers to this. And that's why, as National Public Health Institutes, we really wanted to start the conversation on this topic, not just within our own group not only our own subgroup on Planetary Health and One Health, but beyond that, with other national public health institutes. We want to get us thinking more dynamically together to actually lead to action. And for that, we also want expert input. And that's why we've brought together some experts, 3 experts, to focus on this topic in this webinar. Can we go through to the next slide, please? So we're going to be hearing 3 presentations from our speakers. We're going to have then a time for a discussion where we will be inviting your input, and then we'll wrap up finally for the last hour at the end of our hour and a half. So for the next 2 sessions, I'm going to be handing over to Elizabeth Hall. Thank you very much.
Yes, thank you very much, Angelina. So I'd like to welcome our first speaker, Maya Gilserson. Maya is an associate professor in the Faculty of Health Sciences at Simon Fraser University in Canada, a Michael Smith Health Research Fellow, and a founder of the Researching Eco-Social and Equitable Transformation Lab. Maya is scientific co-lead of the Planetary Health Research Group at Simon Fraser University and a board member of EcoHealth International. Maya, the floor is yours.
Thank you so much. It's really lovely to be here with you all, and thank you for that kind introduction. So my job here today is to share some of the key concepts that we're working with to really ground us in the values and the concepts that we're working with today, and that my fellow presenters are going to animate further in their presentations. So what I want to do then is really talk primarily about social and ecological systems and how that thinking takes form and how we can use it to enact planetary health work. I wanted to begin by acknowledging territory. I'm located in Canada on the West Coast. And here we are in a moment of truth and reconciliation and really putting a lot of attention towards acknowledging territory. And I know that wherever we are around the world, we are all on different territories where people have been living in concert with nature for millennia. And here in this particular place that I'm from, I'm sitting on Musqueam, Squamish, and Tsleil-Waututh territory in the Coast Salish Sea. And the image of the turtle here is depicting North America as it's known as Turtle Island. And you can kind of see, you know, the stretch through the turtle's body. And these are origin stories that place us as people in a world that's connected between sky and earth and ocean, and that it is this that nourishes us and to which we are accountable. And this really animates the kinds of ideas that we are talking about here today. So I hold my hands up to ancestors past, present, and future, both on these territories, but also welcome and honor the places that you are on and the ancient knowledges and the contemporary work that is happening in these spaces. So as I said, I want to talk about ecological systems and social systems. And this framing is really important when we're thinking through systems and we're thinking at the interaction between our Earth system at its largest scale, and the social systems that are these anthropogenic or human creations that we're engaged in, which are changing the face of the planet and bringing us into what we call the Anthropocene. So this is an image that shows on the very left of the screen the interaction between social systems, ecological systems, and then human, animal, and planetary health. And when we're looking at human, animal, and ecosystem health as interconnected, we have lots of ways that we can engage with that. And we can see as we move through this, this diagram that we have created specialisms in Western science around environmental health, animal health, human health, and so on. And the concepts that we're going to talk about here today are depicted in this final part of the slide, where we're trying to make sense of how to work on the interconnectedness of human, animal, and ecosystem health. So I'll unpack this a little bit more as I go. One of the things that this webinar is really dealing with is the fact that we are dealing with such complex and wicked problems. And we're dealing with it at this very global scale. So as a human and ecological community, but that it's also being created by many different forces that are global in nature, but are lived and experienced in our local settings. So when we look at this and when we begin to settle into this framework of planetary boundaries, this is an image of change over time. Perhaps even we can say the rise of the Anthropocene. And we can see the center circle depicts our planetary boundaries, where we're living within our safe operating systems, and all is well, living in the kind of Holocene type context that we live in. And then as we see the accumulative effects of development, of industrialization, and so on, we start as a human family to put a lot of pressure on the Earth system. And you can see from the 1950s to the 70s to 90s to the current time that we're actually putting a lot of pressure on the safe operating space of the planet. And one of the key questions that's animating our conversation today is, how do we actually get back in quite a short amount of time, 2050, for example, to a safe operating space? And so that is one of our really big challenges that we have to deal with. Now, when we look at the work around the Earth system, we see that we've crossed 6, and this fall, actually, it's been said that we've actually crossed 7 of our safe operating thresholds. And this is an assessment that goes that takes us to look at what the Holocene epoch was and how we are doing now. And so this is incredibly concerning, and is being considered a state of emergency for planetary health situation. Now, because of this, there are people who have risen to the challenge of being Earth system guardians and are developing thinking around safe and just Earth system boundaries. And 3 of the ways that we assess how we are doing is we're looking at issues of interspecies justice, we are looking at intergenerational justice, and we're looking also at justice within our current generation, so intragenerational justice. And what we're trying to do is find ways to actually take the health check analysis we have around planetary boundaries and look at how we can actually take these insights and move them to action to bring people into well-being. So what we see here is a story not only of the ecological, but also of the social. And of course, what preoccupies us are the important factors around health and public health. This is an image that shows not only the health impacts of these changing Earth systems and the social drivers of them, but we know too that they are disproportionately impacting people across the globe between countries, but also within countries. And so this is a story of human justice, of social justice, of health justice, and also the justice and well-being of animals. So that's the characterization of the problem that we're all working with here today. And then we begin to look at what is causing these problems and what do we do with them. And what you'll see here today and what we know about the work that is happening in this space is that there are so many brilliant people doing such deep and detailed and thoughtful work, but somehow we still have this lag or this gap between our ability to develop science and even policy around taking action and actually changing the health of the planet, but the health of people and animals as well. So one of these analyses comes out of work in planetary health, where we're trying to characterize what are the upstream factors that are creating these conditions, and why are we stuck in these kinds of cycles. So if we look at underlying drivers, one of the things we see is that a huge push factor are consumption practices, demographic shifts, and technology. And then when we look at the ecological drivers, we're really reminded of the interplay between human activity and planetary activity, and how they actually shift the fundamentals of life, like clean air, clean water, food, and so on. And then they are either mitigated against or enabled through mediating factors, including through governance and policy, through culture, behavior, and so on. And ultimately, they end up with the public health and health impacts that we have to deal with as a health system. So it's very interconnected. And what we see here too is that when we're working in a health system context and trying to deal with these challenges, that we are dealing with a lot of problems that are rooted in our thinking, in our social values, in the stories we tell, in our media, in our governance systems, and so on. And one of the things that a really beautiful Indigenous scholar from Turtle Island says, Nicole Redvers, is something that we've heard many, many times. We can't solve complex problems with the same worldview that created them in the first place. I just want to
You have
quickly
2 minutes left.
thank Elizabeth. So I want to just quickly share with you Planetary Health, which is one of the frameworks that we're using to deal with these issues. And that is taking this very big umbrella approach and helping us think about the planet as a whole and how do we work within these planetary boundaries. We also have One Health, which is another concept that is trying to particularly link human and animal health and understanding that the environment is intrinsic to these kinds of issues, and we can see that playing out through zoonotic and pandemics, for example. And then we have eco-health that really sits more at a regional and local and community level, trying to look at developing healthy communities, healthy people, healthy planet, and healthy animals. And one of the key things that I want to share here when we question why are we moving so slowly? One of them is that we are engaged in a certain kind of thinking that has limitations. When we look around the planet, it is even though Indigenous people have very small cover across the globe in terms of population, about 80% of biodiversity is on Indigenous governed and conserved land. And so one of the things that I really want us to think about here today is what happens when we change the things that we prioritize. When we look, for example, at Indigenous health models, when we look at ourselves as embedded within these systems, and when we look at our health as very holistic, as emotional, mental, physical, and so on. And so what I'm inviting us to do is really move from this anthropocentric view to a cosmological point of view, and to consider a few principles as we move into this conversation. One is relationality, that we're all connected, but also kincentricity is this notion that we are part of a large ecological family that is bound by reciprocity, which is this idea of mutuality, of cooperation, exchange. And so it's in this way, when we're decolonizing our thinking, that we can perhaps move into new ways of working on these really complicated problems, where we are liberated from some of the ways of thinking and practicing and the values we have that actually limit our ability to act in more radical and effective transformational ways. So thank you very much, and I look forward to our conversation.
Super. Thank you so much, Maya, for that very thought-provoking, inspiring presentation. I've learned a new term, kincentricity, obviously reciprocity. I didn't know that one yet, but it kind of provokes all sorts of questions. And I was wondering if there's anyone in the chat, any questions for clarification. We've said we'd have time at the end for a discussion, but if there's any clarifying questions that have come up. Angeline, have you seen anything?
No questions yet.
If anybody wants to ask a question, we have a couple of minutes. If there's anything that's come up, feel free. I don't know if you want to unpack that kincentricity a little bit more for us, Maya, and how we can use that in our work.
Yeah, that's thank you. I think one of the important things is that when we move away from placing humans at the center of our approach, and when we move away also from certain kinds of perhaps neoliberal and colonial sort of worldviews, for example, we stop placing GDP at the center of our work. We stop even trying to shore up capitalism or profit as our key animating principles, because we change our focus out of that sort of capitalistic mindset. And that's not to say that these kinds of practices can't occur. But when we're moving to kincentricity, when we're moving to an ecological notion of reciprocity, we are valuing different things. We're valuing health and well-being. We're valuing connection. We're valuing survivability. We're valuing principles of sustainability that have been built into relational worldviews and traditions, many indigenous worldviews and traditions around the world, place people as one part of a large family of existence, and acknowledge as part of the very fundamental and non-negotiable logic that we are interdependent and interconnected. And so that changes the basic rules of the game and the logic from which we launch our engagement.
Thank you very much for that.
Yeah, you're welcome. I see Dominique ask, which incentives should, in your opinion, be prioritized to shift the general public's point of view towards a more cosmocentric worldview? I mean, that's such a beautiful question. And I think that's one of the core questions. And I think that for public health, for example, one of the challenges that we have is how do we actually motivate transformative or transformational change? And we are certainly not going to achieve planetary health and well-being if we keep repeating the same kinds of priorities. And I think there's an urgency emerging where when we're hitting these tipping points, if we are not more bold, I think that we are just going to end up dealing with downstream issues that overwhelm us. And I think the COVID-19 pandemic showed us that. So one of the things is starting with this unshakable assertion that we are actually interdependent. And there are so many policies, even planetary health governance frameworks, that are or even the guardianship around the just boundaries that are saying a decision has to actually not be evaluated against the profit it can make, but around our contribution to pulling back into health and well-being that can be sustained across generations, species, and countries and people.
Super, thanks very much for that, Maya. And I'm sure this will be food for the discussion later on as well, because it's very much the case of how do we as people from public health institutes also try and motivate that transformational change. So we'll leave that then for the discussion later. And I'd now like to introduce Joyce Brown. Joyce is a medical doctor and epidemiologist and is currently an associate professor of global health and epidemiology at the Julius Center for Health Sciences and Primary Care at University Medical Center Utrecht, the Netherlands. And her work focuses on global maternal health research, health equity, and equitable partnerships in global health, research capacity building in low and middle income countries, and education in global and planetary health. So Joyce, delighted to have you with us, and the floor is yours.
Thank you. And thank you also for the invitation to be here. What I would like to spend the next 10 minutes with you and everyone here thinking about is how can we make sure we anchor an equity lens and a climate justice lens in all the planetary health transitions and transformations we are now jointly embarking. Because I'm a little bit concerned, actually, if I look at the state of the world, but also where a lot of the transformation and transition energy is, that we might have a missed opportunity at our hands to transform public health systems in one that are both more sustainable, but also more equitable, and make sure that health well-being is available to everyone worldwide, both between different countries and within different countries. So that will be the three things I will try to convey. One is we are in this transition towards a more sustainable healthcare, but how can we design this process to make sure that we embed climate justice in a health equity lens? My second one is to also dive a little bit deeper into this conceptual connection between climate justice, a core foundational principle of planetary health, and health equity, because it helps to see how the two can be integrated in this transformative pathway. And I will be asking a lot of questions because we are in partially uncharted territory. So it requires a lot of collaboration, learning, and sharing. And this network is a wonderful opportunity to actually compare different approaches and understand what works, but also to accelerate learning across these systems. And this all fits into the transitions and transformational model that I will discuss in a bit as well. So I already mentioned the word transformation, and in order to be on the same page, I will just share with you how I generally approach transformation and transitions thinking. And this is developed by a research group affiliated with the Erasmus University in Rotterdam. So one of the questions I also would be really curious to hear from you is to what extent this translates to other settings. But one of the things that draws me to this model is that it's very, it helps explain what we see in the world. And in fact, it was not even created within with a focus on healthcare, but on fossil fuel transitions. So we're already using a model that seems to resonate in other domains and see what we can learn in the healthcare sector. Because to be honest, we are a little bit late to the transitions party compared to many other domains and sectors in society. So this model is called the X curve. And like I said, was developed by scientists, transition scientists in Rotterdam, undoubtedly with international inputs collaborators. And you see two arms of this X. One starts here in the upper right quadrant, the current system as we have, the public health system as we have. The upper left corner. The upper right corner is an overview of the future we want to aspire for and what we want to transition into. But these models, they cannot exist in the same world completely because there is just a limited resource. And in order to find this future, which is more planetary proof and hopefully sustainable from both an ecological point of view as well as a social point of view, we also need to not stop doing a number of things we're currently doing because our current systems are just not sustainable. Yet we are currently here in a system that is consistently trying to optimize its working. We are all trained as public health professionals to think through what can I do better based on the current system. So optimization is our current way of working. Yet, if you want to go to this future that we aspire to, we also need to build up new systems and new ways of working, and that requires experimentation. It requires learning to make sure that we accelerate the transitions and learn from what has emerged from these experiments. That allows emergence. And here, at some point, you will see the old way of working clashing with these new emerging ways of working. And this is a chaos point where a lot of decisions, where things are a little bit more fluid. And there are tensions between what the old world wanted to be and what we are trying to work towards for a new world. And this chaos point is one that is a little bit unsettling at times. It's where tensions occur with different interests that might conflict. And it's an opportunity to then help steer what will happen next. Will we indeed enter this new future, institutionalize our new ways of working and make sure this stabilizes? And inherently this means that we will break down and phase out a number of the old ways of working, or will we go reverse back into this old system? Of course, this picture doesn't do justice to something that is really important, that some of the things from the old ways of working, the old systems, are actually very valuable and should be maintained also for the future. So one of the lines that should be drawn here always is, what should we keep and then take along with us into the future? And that is also a very helpful narrative often to start to change and start to embark on this collaboration and collaboratively transform systems, because it is actually a wonderful question to explore what is going well, what do we want to maintain into the future, and what should we do different, and why, and what can this different then look like? It changes the narrative from something that you lose to something that you gain together. But what do we want to gain together? So a key question everyone should ask, and I would be really interested to also knowing and learning better how you would answer these questions for different countries and different public health systems, is, do we have a clear vision of what a planetary-proof public health systems can and should look like? And how do we ensure that these principles of climate justice that conceptually connect to health equity are embedded? And what would that require from all of us? So let's dive into these two concepts of climate justice and health equity. So health equity is, I'm sure, very familiar to everyone here. It's wonderful to be at a public health audience, with a public health audience where this is a recurrent theme, I'm sure, because it focuses on the equal opportunity to health, so that we avoid unfair differences, and if they would arise, that we have addressed and mitigated them. And you see already the first bit of a circle, because we're going to draw a Venn diagram together. But on the other hand, climate justice, which I here try to heuristically define. So I know I don't do justice to all the components of justice, but this is a way that helps me to think about climate justice in a very practical way, because it helps if you conceptualize it as a fair balance between risks or harms and benefits linked to climate change and environmental changes, and a fair balance between your ability or a system's ability or a country's ability to mitigate or adapt to these climate changes. What is important, and that also links to Maya's presentation, it includes also the considerations and interests of non-human species, like ecosystems, like biodiversities, animals, and other considerations. And where these two join together is in this current and future generation thinking. And that was also really nice about the previous presentation. We have climate justice and health equity meet a lot in considering the health of current, but also future generation, this intergenerational health equity perspective, and of course, everywhere in the world. What is important to realize is that these two are affected by the healthcare transition choices we now make, because in the choices we make, and especially in our the risk assessments of possible harms or inequities that will grow, we can also choose to mitigate and design our approaches in a way that it actually actively reduces these inequities that exist and otherwise might increase. And that's an important consideration, because one of the helpful thought exercises is always, what happens if we embark on a transition where we would not do this, and we leave this deliberate integration aside. And this is a preliminary conceptualization of what I see happening in the Netherlands, where we have a wonderful and extremely energetic and effective transition in an ecological sense, where there is a lot of rapid buy-in of different stakeholders, both from the highest levels of our Ministry of Health to executive boards of our hospitals and health facilities, all the way to grassroots initiatives to initiate and accelerate transitions that are green. But what I at the same time also observe is that the same energy I don't see happening on the equity transition scale, so on the social dilemma. So one of my biggest worries for the Netherlands, and I think this might be a play also elsewhere, but again, I'm really curious about your thoughts on this, is that we are going through a rapid impact pathway for the ecological transition, reducing waste, reducing our emissions, but the pace is not being kept up by the societal transitions that we also need towards a more equitable system that does justice to the health needs of everyone. And if we don't include this, we might risk increasing the existing gaps. And it's a missed opportunity because we're already transitioning and transforming a system. Why not make sure that also the social transformation and health equity transformation follows in the same pace? So that will also be my question to you. What is necessary to do this? Do you have already a very clear vision of what a planetary health transition that would touch on both the ecological dimensions of planetary health as well as the justice and health equity dimensions of planetary health is adequately incorporated? And as I said, one of the reasons why I'm so curious is that we are in uncharted territories. We are in developing all these models and empirically testing them. So one of my requests also to all of you is, while you are embarking on this transition, make sure you also embed learning and sharing of these learnings, both within your network, so within different public health institutes, but also with the wider society and academia. We are all in a societal transition together. Every sector is working on this. There is a lot we can learn, and that's also an open invitation to everyone. Make sure that you connect with academia and knowledge institutions to also document and accelerate this shared learning, because there is so much work to do. It would be a lost opportunity if we will not devise ways to accelerate the learning and transitioning together. So thank you very much.
Thank you so much, Joyce. That was really interesting, and you've again very thought-provoking, lots of food for thought for us. You've given us a lot of questions to answer, and I'm sure we won't be able to answer them all this afternoon. But I'll first have a look at the audience. Are there any questions from the audience, Angelina?
Yeah, we've got a couple of questions here. So I think I'll start with a question about the curve. We have a question whether chaos is inevitable. So this was your graph that was showing the chaos, I think, in the middle there.
I think chaos is not necessarily a negative word, if that's part of the worry of this question. Chaos, in how I think it's very helpful to conceptualize it, is an area in which things as we used to do them do not hold anymore. They do not fit the purpose of what we want to transition towards. So this unrest of knowing that what you've been doing is not sufficient anymore for a future as we inspire introduces uncertainty, and within this uncertainty there is some chaos because you don't yet know what it will look like in the future. So yes, I would say it's inevitable, but I would not necessarily consider it a negative term. It's just I think a neutral description of a state of uncertainty that is inevitable indeed.
So we have one further question here. It's less of a clarifying question, but perhaps we can pick up on it if we've got a moment, Elizabeth. So we have a question saying it's very thought-provoking and interesting. We think we have visions of sustainable healthcare, but not one shared vision, and that's a challenge. How can we support and arrive at a shared vision?
Again, I know a lot of things are taking place on both national, regional, but also global levels. And I think actually many of you here are part of these conversations. So for example, the WHO resolution on climate and health is really interesting because it does explicitly focus on the two dimensions, the ecological, sustainable transitions, but also the health equity and justice transitions. So I would start with the conversations that are taking place already. So, and I've heard, or also your introductions this series of webinars will likely not be the first, but it will be there will be follow-ups, and centering this question, what could it look like, and how do we then translate it to national systems and plans, is one I would really encourage to center here, and invite also deliberate of speakers that can add and answer this question from specific angles.
Super, thanks very much. Angelina, were there any others, or should we move on to our last speaker,
I think that's the end of the clarifying questions. We've got a couple of points to pick up in the discussion.
Absolutely, we've got loads to discuss after the last speaker. So I now move on to our last speaker. I'm delighted to welcome Horacio Riojas Rodriguez. Horacio is a medical doctor and director of the Environmental Health Department at the Center for Population Health Research at the National Institute of Public Health of Mexico. He has coordinated the special program on planetary health at the Institute and leads the research line on health and the environment. He is founder and coordinator of the PhD program in environmental health sciences at the Mexican National Institute of Public Health. Horacio, the floor is yours.
Thank you so much. Good morning here from Mexico. Thank you very much for the organizer for inviting me to this webinar. Can you see my slides? Yes.
Yes, we can.
Okay, I'm going to present the experience we have had at our institute trying to develop our special program on planetary health. And this is a compromise after these two very good presentations. And I would say that is an example on how we are trying to put in practice this concept of planetary health at our institute. The initiative to create this program is part of a renewal process of our institute in the face of climate and environmental crisis, and also in the face of new challenges that the health system faces after the pandemic. The Planetary Health Program was an initiative of our previous director, supported by a group of transdisciplinary researchers, and is part of our two special programs that we have at our institute. The other one is on indigenous health population, and this is our new program on planetary health. What we are trying to do is to establish the areas of planetary health at our institute with implementation of key research, teaching, public health policies, advocacy, and university extension activities to contribute to the exercise of the right to human health and health environment with the framework of equity and sustainable, trying to use some of the concepts that Mara and Joyce have already presented, and trying to put them in practice. Briefly, we have, this is our special program. We have 5 action axes. The main one is research. We are trying to develop some new frameworks and some new issues of research, trying to put in practice the planetary health research with different group of researchers in areas such as vector-borne diseases, nutrition, environmental health, climate change, and other. The main thing is that with this program, we are putting in practice a kind of new focus on transdisciplinary approaches, trying to find and to answer questions related with planetary health from this different point of view. The other very important part is teaching, because we are in a process to change the public health programs at our institute. We have the Mexican School of Public Health, and we are changing many programs and trying to introduce these new concepts on planetary health in all the public health programs. And we also have another part that has to do with health advocacy and promotion, and trying to design and evaluate new public health policies, and trying to influence in the health and environmental and other sectors with proposals. Some of them I will show you briefly later. We already have our website on the special program on planetary health. You can visit there and you will find all the different activities, research programs, and training that we already have in our institute. We have already published 2 papers related with planetary health because we think that it's very important to have this new framework from our country, from our region, from Latin America. So we developed a perspective and we put there what we understand on planetary health and how we are trying to develop our planetary health programs in our country and in our region. So this is a very important paper, and we have another one because we have also a national network on planetary health and analysis of syndemic processes. I will show that we have this national network of planetary health and how we are working on this on different aspects of planetary health. We have already put in practice a summer course. Last summer, we have our first planetary health course. This was very important. We have there almost 30 participants. We review all the concepts of planetary health, and we have different local cases, case studies, trying to put in practice the concept of planetary health and the situations in different regions of Mexico, trying to find solutions and trying to ask research questions in this, what we call the syndemic situation in which there are social and environmental problems. And this is the focus that we give for this planetary health course last summer, and we are trying to also incorporate this course in other public health programs in our institute and also in other universities and institutes. As I mentioned, we have this national network we call Species, Assessment of Planetary Health in Emerging Syndemic Scenarios. We have almost 10 institutions working together in this planetary health network. We are working during this year, trying to build this new network and trying to have different activities related with research, training, and trying to impact in policies, especially in the new health programs in our country. We are organized in this way. We have almost this new network, and we are organized what we call the nodes. We have a climate and atmospheric crisis node, another on agri-food systems, chemical mixtures and water crisis, and also integrative health. We have these 5 nodes, and we have a lot of seminars, webinars, and capacity related with these 5 nodes. We are already now members of Planetary Health Alliance, and the other very important part is that we are working, trying to propose contents for the university with our network. We are working with different state and national universities, trying to create contents on planetary health that could be included in different faculties and in different training programs in those universities. We are starting working on that, and we have some examples in some of these universities. We have some successful examples related with our intervention in our institute, in our regional environment, and also published in media some different issues on different issues related with planetary health. And we have also environmental education with in our projects in different local and regional communities. So these are some of the activities that we are already put in practice. We also have new research programs. So as you can see in this example, we have this project in Chiapas in the south east of Mexico. That is an evaluation of an action plan that we are co-developing with the communities and local actors, trying to develop a program related with heat-related diseases, and trying to develop an intervention and to evaluate them. We have a fund from Wellcome Trust Fund Foundation, and this is the kind of research program that we're trying to implement in our institute and also in our network. This project has aimed to design an early warning system related with climate change, with local participation with the communities, and we are in the first step of this project. This is just an example of the kind of project that we are trying to develop here in Mexico. The other thing is that we are trying to create different documents related with planetary health problems. This is an example of the position on climate change and health policies in Mexico. We have already this document that we are sharing with federal and local policymakers, because we are in a kind of transition of government right now. So in our network, we have discussed the issue of policies on climate health and health, and we have produced this document that we are circulating between local and federal authorities with different proposals related with climate change and health. Here in Mexico, we have around 12 or more proposals related with this, and trying to develop a national plan on climate change and health. We have also different seminars. This week we will start these seminars on planetary health and complex systems, because within that to develop health, taking into account different concepts of complex system, we will have this seminar that will last around 3 months. We have already 85 participants on this seminar, but we have had also another seminar in different issues such as climate change, agrosystem and health, and water scarcity, among others. So I think that this idea of develop this national network on planetary health has been a very good one, since we have a very interest in different issues related with planetary health, and we have in such way developed this kind of seminars. For some next steps, we are trying to develop an observatory on planetary health here in Mexico. This one we are trying to develop, and also to publish another position paper related with other issues. And we are also working in different events related with the climate crisis and health, such as this one that will be taking place in Oaxaca next week, and also collaborating with the local market on the waste management and other activities. And this is more or less what we are trying to do to put in place and in practice those different concepts of planetary health. This is very new for us, but we are trying to put together a very good proposal and trying to get some comments from you and from others, trying to put in practice this issue on planetary health. Thank you.
Thank you very much, Horacio. It's great that you've made it so tangible for us with these excellent examples of what a National Institute of Public Health can do with this topic. So I think you're very much a pioneer in Mexico on this theme, so excellent. And I'm sure there'll be some questions from the audience on this. So we'll first look if there are any clarifying questions, Angelina, and then we can move on to a more broad discussion.
Yeah, so we've got one clarifying question here on whether you can elaborate on the early warning system and the criteria used that you mentioned, and have any new structures been created to support this?
Well, we are working together with some climatologists from the National University, trying to have an early warning system at local level. So we have the participation with local authorities and local communities, because what we are trying to do is that they will manage this early warning system at local level. We have, for example, early warning system at national state level, where we are working. We are trying to have this kind of early warning system at local level. So we have had a capacity building at that level, because what we are trying to do is that the local people have the capacity to manage these new early warning systems and help.
That's really good to hear. Like, you've seen how horribly wrong it's gone in Valencia, last week, when the warnings didn't seem to get to the local level, and how important it is that the local level is sufficiently informed. Any more questions, Angelina?
Yeah, so we've got another question here on what challenges did you face in implementing your approach of planetary health, and how were any of these challenges also overcome?
Well, as I think Joyce mentioned, that we have a lot of challenge precisely from the health sector, that do not fully understand what this kind of framework is. There's a challenge there, because they are more worried about the assistants and the hospitals and the clinics. So there's a challenge to work with the health system persons to understand this new vision on public health and planetary health. I think that's one of the big issues and one of the big challenges that we are facing in different countries here in Latin America.
And can you elaborate on how you've worked with this particular challenge, how you've maybe overcome this?
Sorry, I can't hear you. Can you repeat, please?
Yeah, can you say how you've maybe worked, or how you've overcome maybe working with, or what, if you've done anything about helping to the healthcare sector to understand or to get a bit more on board, or is this something that's still a work in progress?
No, we are trying to develop some kind of different
You still with us, Horacio?
I can, yes, I'm here. I don't know if I understand well the question, but what I want to say that we are trying to develop different kind of courses with different kind of people for the health sector, mainly with with our master programs, that because there participate many people who will work on the health system, but we are also trying to put in practice some different kind of courses with the medical, with the public health person that are already working at the public health system.
Thank you very much. I think probably we can now open this up to the wider audience. So I'd welcome everybody to put on their cameras, put their hands up if you have a question. Maybe there are some remaining questions from earlier on, Angelina, that are more suitable for the discussion now. So if there's anything we need to carry on over from the chat, or if anybody has a question they'd like to share now, please put up your hand.
Absolutely. So we've got a couple of points from earlier on. Lisbeth, did we also want to ask for our statements from our speakers?
Yes, we had a statement, didn't we? Do you have it in front of you, Angelina, by any chance?
I don't have that in front of me, I'm afraid. We can see if we can pick that up. Perhaps Yeah, perhaps then we can go to one of the first questions that was raised about how a cosmocentric worldview is perhaps sometimes difficult to communicate as a National Public Health Institute. Even the term One Health remains difficult to be taken seriously. So how is this something that we can deal with? We've also had just to add to that, we've also got a comment in response to that saying that sometimes an ecocentric approach can help with this a little. But so now we're into some of the terminology and how we use this terminology as National Public Health Institutes.
Should I jump in? I love those questions, and I think definitely with complex issues, wicked and super wicked problems, in the Canadian context, we also talk a lot about untying the colonial knot. And all of those movements are about just trying to look at the threads. And Joyce and I were chatting a little bit in the chat here about, you know, how do we do these kinds of things? So I think breaking the issues down, actually naming things. I think partly what happens with disinformation, with not with always working downstream, is we actually have to go upstream and we have to name things. And we have to name the values and we have to name who benefits and who doesn't, which is a justice kind of point of view. And I think too, when we look at these different worldviews, I mean, one thing that I think public health can do is really, really insist that we need, as basic human rights, or to enact that basic human right, clean water, clean air, you know, healthy food, these very fundamental issues. So if we don't care about, you know, clean water for the planet, that's one thing. You know, but if we care about it for our health, so what motivates people to kind of enroll in an effort is variable. And we do a lot of climate change communication research that shows we have to be very, you know, targeted about our interventions. But I think naming where we are and how we got here is really important. And I think also engaging people in citizen science and being really community engaged. And with a lot of these issues, it's at that local level that people are living the impacts of disproportionate stressors, but also they are the first line stewards of water and air and food and so on. So, you know, there's this opportunity to come together in communities of well-being that stand against, you know, corporate greed and so on. So I think being really clear about what we need fundamentally for human health will help us.
And maybe to add, it's also a message of hope, and actually a very positive one, because everyone very fun. If you ask people, what do you care most about? It's generally health. It's having children who are able to flourish, to play, to have access to clean water. So that's really interesting. All the values that are and requirements for planetary health are values and requirements that are deeply one that, well, that's actually easy to rally everyone around. The question is then why do we fail in succeeding better? And then the root cause analysis becomes interesting. All those societal patterns that have resulted in the situation as we are in today. But if you help people understand this is the future we aspire to, this is why we haven't reached it, but this is what we propose we will do together. And not only very abstract, but make it really practical to the level of communities and individuals. You might have you ideally have a narrative that moves mountains. And then one of the most important things is, and that's procedure, is another concept of climate justice, procedural justice. Because one of the things that goes wrong is that for some reason we lose track of these in weighing all the different interests and perspectives and priorities. The interests of individuals and their health sometimes lose out over other interests. And how can we, in our decision-making process, make sure that these are appropriately balanced so that you actually are more planetary proof in your decision making?
Thanks, Joyce. I think that's so important that we have a positive message and that it resonates with people. And you're absolutely right. This is so essential to life, that we have a good health and that we flourish and our children flourish and their children flourish. So it's really good that you stress that, and that we avoid a more kind of the doom and gloom scenario and narrative. Let's have a look. I think we have another question in the chat. Oh no, that's Maya has something to add to that.
Yeah, Elizabeth, we also now have our question.
Oh, yeah, thank you. Yeah, do you want to read it out?
Yeah, of course. So our question is, why are national public health institutes ideally placed to push forward the planetary health agenda?
So who would like to kick off on that one?
Can I answer that?
Please.
Yeah, well, first, I think that if us as a National Institute of Public Health are worried and we are working on this issue, and the rest of the society is looking at us and they say, so this is something important, and we are producing different results and different issues related with planetary health and human health and animal health. So I think that's a message. That's the first thing that is important. The second is that we need to have some products related with research and planetary health to show the other what is the situation in each region, and trying to have some alternatives for that. I think that the research is important in this part. The other important thing is that I think is the capacity building for different actors at different levels. So I think that we need to work on that with our students, but also with other universities. And I think that also this kind of network that we are creating at international level is important, because that's also another message to show that all the national institutes have this concern and have proposals to deal with this. So I think that will be at least 3 things that we have to take into account.
Thank you very much, Horacio. Yes, I think that sharing as well with each other is so important. At RIVM, we're now developing a vision on planetary health. So it's very useful for us to hear about the good examples that are out there and the process that everybody is going through at the moment. So thank you very much for that. Would anybody else like to come in on this question? So why are National Public Health Institutes ideally placed to push forward this agenda on planetary health? I would also like to open it up to the audience. If somebody would like to share, put on your camera, join in the discussion, please. Maybe there's some other good practices. I'm sure there's some other good practices and ideas out there. Don't be shy. Are there any hands up yet?
I see Michaela shared something in the chat that might be worthwhile reading out.
Michaela, please put your camera on. Let's hear your contribution, please.
Yes, sure. I already wrote it in the comments field, as I didn't know if you were still going to discuss. But I see, yeah, public health institutes is very critical as we are the guardians of human health, and just I think that's already a good starting point. So protecting human health and what that already means in the context of planetary health. So we already have that platform or or a voice in the discussion around human health, and I think we can use that as a good starting point.
I think you already have some experiences in Finland, don't you? Because you've been rolling this concept out. I think you're one of the pioneer institute, as far as I understood it. Is there anything you'd like to share about your experiences there?
Yes, thank you. Yes, so I think we have both on a very concrete level experience in raising awareness around how we are connected with the environment. So in understanding what the environment, what the nature has, its role in creating health and well-being. So both that kind of an understanding, we just made some calculations also, like economical calculations on this benefit. So taking in that aspect also into the discussion. So had some interesting findings in sense of what nature brings in order of what would I say, saved healthcare costs for asthma, diabetes, and depression. So on that level, but then also we have concrete examples of healthcare professionals taking people outdoors and trying to promote that understanding of the importance of nature for our own health. But then also here at the Institute for the Finnish Institute for Health and Welfare, we are also trying to integrate this kind of planetary health thinking into all our work, which is easier in some sectors than in others. I think within the nutrition department, it's been really easy. I mean, they're already using the Eat Lancet Planetary Health Diet as a stepping stone for a broad understanding has been very fruitful, but also when it comes to active transport and other like concrete fields where you can introduce this kind of thinking. So a lot on our plate right now. Thank you.
Super, thanks for sharing those examples, Michaela. I like that fact that you're doing those cost-benefit analysis. That's really interesting. So I'm sure there are more examples out there. I saw some more cameras going on, so I don't know if anybody else would like to share anything with us. Please put up your hand. Can we see any hands?
We also have a question in the chat from from the start, actually more from the start of this presentation, but perhaps we can pick it up. It's a question on whether we can build a planetary health public health system in a neoliberal country. Is it possible to discuss justice and equity without discussing the roots of injustice and inequities? We've got a couple of responses from Joyce and also from Maya. So perhaps we can pick up on that. Perhaps that might be an interesting one to respond to from a national public health perspective, considering in Mexico that's also been this is something that you've been taking forwards. Horacio, perhaps this is a question that you might be interested in responding to, if I can direct that towards you. Is it possible?
Thank you,
yes. Mm-hmm.
Yes, of course. I think that the Maya presentation was very interesting on that, because we are not just looking on the effects and the mediation of the different factors, but also the roots of this kind of crisis. And in that way, we are also discussing this issue on the colonization of the planetary health concept, because there is a lot of things that have to do with our story and how this environmental crisis was created. So we think we have this discussion on the economic and social roots of this crisis, and there's no doubt that this has to do with the solution of this, and I think that's something that we need to take into account to understand what is happening and also the solutions.
I might jump in and just say too that with I think with our COVID-19 kind of global efforts, and I know we've talked a lot about this, you know, in media and so on, we saw that if there's a value shift, or if people really understand, you know, what's at stake, we can make really radical changes. And also, you know, we see that economies adapt. And you know, even, you know, and new economic opportunities arise. So although we have to be vigilant about that, I think, you know, humans have always been super adaptive, and we have an instinct to survive. And I agree with Joyce. We need to be strength-based. We need to be resilient. We need to have, you know, these transformational impulses, because that's what people have been doing and are doing right now in all sorts of conditions of challenge and you know, despair. So we have, and we owe it, as Joyce was saying too, to our youth to be strong, to develop resilience, to build a world that they can live and thrive in, because that is their, you know, that is their future that we are trying to protect. So I think that there's we can trust our ingenuity and adaptability. We can engage in, you know, what we're referring to as just transitions in the Canadian context around moving away from oil and gas, or we could think about how we engage in new extraction projects. In Canada, we're doing mining for rare earth minerals and so on. You know, can we change our social metabolism to not want to consume so much of these resources, but also how can we do it in a much wiser way? And I think there's so much knowledge and so much capacity, but I think that we continue to fight against you know, these bottom lines of profit for private corporations and shareholders, which are, we know from the climate story, are a very few number of people who are disproportionately impacting, you know, most of the globe and the Earth system and, you know, flora and fauna. So it's a value shift as much as anything that needs to happen, because everything else is in place in a way, or could come online.
And maybe interesting here to recognize is also how different that the situation where we're in now of climate change and biodiversity loss and all the other crises, the polar crisis we're facing is human-made and a consequence of historic and sociologic patterns that, well, pre-industrial revolution, but accelerating post-industrial revolution. So we're now also, so that means that if you understand it's an historical conversation, it also means the causes and consequences are unfairly balanced at the moment. And that's something that is interesting for also the audience here, because you are national public health institutes. So your mandate officially is focused on your own countries. And for a country like the Netherlands, that is a kingdom that includes countries and territories in the Caribbean, there is inherent this change of geopolitical dimension where there are lower resource settings that bear the brunt of the consequence at the moment, and a high resource continental part that is less, also faces consequences, but is more able to adapt and mitigate. That is within one country. So, but then there is also this question of how do we justify or how do we make sure that climate justice transcends these national boundaries and includes international solidarity as a guiding principle too. in order to reach equity in health and well-being for everyone, regardless of where you are. Because in the end, if you look at the distribution of the causes, that is predominantly high income country generated, but then most of the consequences are faced in the lower resource settings. And understanding this means it's also a really interesting question, what is asked for international public health institutes. So in addition to taking only care of our own mandated population, how do we ensure climate justice perspectives of solidarity are also part of what we advocate for other populations?
Yes, a very burning question. I think, how do we, our mandate is national. We tend to get all our work commissioned from the national, but we still need to take that international perspective, and how do we take that on board? And especially in countries who have that colonial past, and when we have our Caribbean islands and the inequities, and obviously also in continental Netherlands, there are a lot of inequalities and inequities, but even more so when we look at the Caribbean regions. I was wondering, I saw Sonia would like to come in. We only have a couple more minutes, but Sonia, do you have a burning question? Please ask.
Yeah, I'll try and make it brief because I know we're running out of time, but just also to thank the three speakers. This has been really interesting. I am Sonia Mira. I'm a researcher at the Norwegian Institute of Public Health. So of course I come with a Public Health Institute perspective and agree with all of your, I very strongly believe there's a very important role to play. But I wanted to mention that I just had this privilege of returning from the Climate and Health Africa conference this past week in Zimbabwe. I encourage everyone to look into, I'm sure they will have the videos of, they had over, I think nearly 400 participants from 30 countries, mostly in the global south. And so that was my question comment, is just to ask, I think mostly directed at Dr. Riojas, that I think it was clear that, for example, the host country, Zimbabwe, is now just in the process of establishing a public health institute, but of course has many challenges. I think there's many countries in a similar situation, which unlike Mexico, with, I think your institute maybe is 100 years old. What would your advice be to how to prioritize or how to find, resources? I think this is a challenge that, as I really felt I had to say something to follow up on the last speaker's comments, that I think this is really very much a challenge. Over. Thank you so much.
Horacio, if you could answer that in 1 minute, and then we can move on to the wrap-up.
Yeah.
Thank you.
Yeah, thank you for the question. Yes, we are, as maybe in Africa, also in our region, we are facing these very big problems to face this kind of crisis. In fact, we just have had 2 weeks ago a meeting on the regional researchers on climate change and health. And we, in all the region, we have this problem with the resources. Most of the resources for research right now in our region come from outside. We do not have so much national funding for climate change and health, for example. So we are trying to create this kind of network of researchers on climate change and health, and trying to find some support from outside, and trying to convince the national scientific authorities to get more funds for research and programs in our countries. So we are facing this issue in an important way, and also trying to influence the health programs to address this environmental crisis, and trying to develop national programs on environmental health, on planetary health, or whatever focus, because there's a lack of that. So we need to pressure to have more of this kind of programs. And in that way, it's very important to have these kind of international networks and have support from other national institutes from other countries. So it's a very good comment. We are because in fact we are facing this problem and trying to develop this kind of networks and looking for resources, and also trying to have to work more on capacity buildings in health sectors and others. So we are facing similar challenges that they are facing in Africa, and that's we are trying to link with different kind of networks on these issues. So this is a very important question, and thank you, Sonja, for that.
Thank you very much, Horacio. Just to add, I know that the WHO is developing a global research agenda on climate change and health. So it's not planetary health, but climate change and health. So there will hopefully be some funding coming out of that. And also the European Union, the Commission, is also developing a research agenda on climate change and health. And I know quite a lot of the calls do encourage consortia to engage with countries outside the EU. So hopefully that will provide some funding opportunities as well. So on that note, I'd like to hand over to Angelina for the final wrap up. Over to you, Angelina.
Thanks so much, Lisbeth. Yeah, I think in the interest of time, I'm not going to do a full sort of synthesis of our three presentations, but I just really want to thank all of the speakers, Dr. Maya Gislason, Dr. Joyce Brown, Dr. Horacio Rodriguez, for providing a really nice, and I think a fairly comprehensive set of presentations focusing on different aspects of planetary health, One Health, systems approaches for us as National Public Health Institutes. I think we've heard more from the principled sort of or principle-based approach. We've heard also quite a theoretical sort of description of planetary health and transformation, and we've then also really heard from a national public health perspective. I think it's been for me a really rich set of inputs and discussion, and I just want to thank everyone, the entire team of contributors who've made this webinar possible. I think it's not possible to name everyone right now, but of course the speakers, Elizabeth Hall, the planning group of the IANPHI subgroup for planetary health and One Health, then the committee itself, of course. And we're going to now take these, so we'll make the recording of this webinar and the slides available to everyone. The IANPHI Secretariat will take care of that. We're going to take these rich discussions and the materials and write a short summary for the web of this webinar for the IANPHI website, so that that's available to anyone who wasn't able to attend, and also so that we can really make sure there's a kind of a legacy of this discussion. And we're also considering writing a short paper together on this topic, really to kind of put the spotlight on National Public Health Institutes and their role in pushing forward this agenda. And Dr. Joyce Brown also already mentioned, we are also thinking and looking into future webinars on this topic, because we really see that there's so many different aspects that are essential for us to continue discussing, looking more deeply into. So watch this space, we'll be in contact, and there's nothing left for me but to thank you all for attending as well. Thank you all.
Thanks. Are you hanging on in there, Angelina?
Yes, I'm going to wait in here for a moment just to see.
I just took the liberty of just putting everyone in the waiting room. So because often people are just hanging out while they.
Oh, good for you. I didn't know how to do that. I thought maybe we could.
No, that's.
Thank you so much for doing that. Yeah, I mean, I've already just said it, but thank you so much, all of you, for really fantastic contributions.